Thank you, Ken Corla. We are truly, as you've outlined, living in extraordinary times. This pandemic that we're now endeavouring to deal with was unknown to our world just a number of weeks ago. Now it's often all we think and talk about. Today's sitting is, in and of itself, reflective of the extraordinary impact of COVID-19. Despite this perhaps being the biggest single issue this Oireachtas may face with our people, the public health advice is that we cannot all gather here at one time. This Oireachtas, its members, and indeed you, Ken Corla, have risen to that logistical challenge that confronts us. And I want to take this opportunity to thank all members of the Oireachtas for the constructive way we have all worked together. There is no time for petty party politics during a pandemic. I also want to praise the staff here, especially the canteen staff, the ushers, the officials, our own personal staff, who work so hard and look after us on these long days. You continue to provide us with a safe place to work, and quite often are the people who keep us going on these very tough days, and we thank you. Ken Corla, I also want to take this opportunity to thank our frontline staff in the Irish Health Service, our GPs, our hospital doctors, our nurses and midwives, our paramedics, support staff, cleaners, porters, patient support staff, my own Chief Medical Officer, Dr. Tony Houlihan, and his team in the Department of Health, the HSE leadership team, our social protection staff, all the people working across the public services, and particularly our emergency services, the Gardaí and the Defence Forces. Everybody is coming together in a true national effort. Our health service staff and their families have made and continue to make massive personal sacrifices in the face of this global pandemic. Their bravery and their courage has been matched by the generosity of the Irish people. Over 30,000 people have answered the call of government to offer the HSE their assistance during this time of crisis. Thousands of people are putting their hand up and saying, I want to be on call for Ireland. And today we say thank you to each and every one of them. Thank you also to the men, the women and the children across this country, helping their neighbours, their friends, their families, as we all struggle to adjust to what is a temporary but very significant new reality. We, as political leaders, of course, have a responsibility to lead and to respond to the pandemic. But we also all have an equally important role in responding to the mental health challenges and the well-being that this will pose for many of our people. The individual and national anxiety that now exists right here in our country. Every day I wake to messages, to phone calls, to emails offering help. Every day I see videos of people using their own creativity and innovation to help themselves and help each other. Through these tough times, the Irish people continue to show strength and resilience. They continue to care for each other. In the dark days ahead, the Irish people will be the light that guides us through. Ken Corla, before I move on to the detail of the legislation, I think it's very important we take this opportunity to remind the Irish people what we need them to do. We cannot stop this virus. We cannot wish it away. As our published figures showed last night, it is a virus that does not discriminate based on age, gender or geographic location. But what we can all do is help slow its spread. We can help our health service, help our frontline staff, help older people in the community and vulnerable people by following the guidance and advice of public health experts. It's simple. Wash your hands regularly and properly. Cough into your elbow. Dispose of your tissues. Reduce significantly your social activity. Help us help you. We will only flatten the curve if we work together. But if we do work together, we will save many, many lives. At a time like this, we often rely on our country's greats to motivate and inspire us. One such great, Seamus Heaney, said, "Hope is not optimism, which expects things to turn out well, but is something rooted in the conviction that there is a good worth working for." Let us all here in this Oireachtas, and all of us right across this country, work day and night to achieve that common good. Ken Corla, I move that the Health Preservation and Protection and other emergency measures in the Public Interest Bill do now be read a second time. I want to say at the outset, I see sense in the amendments deputies have proposed with regard to a sunset clause, and I'll work with deputies on this when we get to later stages in this bill. I also know a number of deputies have expressed concerns in relation to protecting and supporting renters at this difficult time, and I know my colleague Minister Murphy intends to bring forward legislation in that regard next week. But our highest priority today must be the protection of both public health and human life, preventing the spread of the virus and working to mitigate its impact on our people. With this in mind, we are introducing a series of supports to help those who are ill, who are quarantined, who are in isolation, or who are unemployed as a result of COVID-19. We're also temporarily changing the rules of illness benefit payments and job seekers payments for workers affected by COVID-19. And we're introducing measures that will serve to prevent, limit, minimise or slow the spread of COVID by ensuring, insofar as is possible, that potential avenues where there is a high risk of contact with the virus are closed off, and that those who are potentially infected are provided with the necessary medical assistance as and when they require it. I will now outline the main provisions of this bill. Section 1 provides for the short title Construction Commencement and Duration of the Bill. Sections relating to illness benefit come into operation from the 9th of March, the date of the government decision on illness benefit. Sections relating to job seekers payment come into effect from the 13th of March. These amendments will continue in effect until the 9th of May 2020. However, if so required by the interest of public health at that time, the amendments may continue to operate by order. Any regulations introduced under the provisions of the Act will also lapse on that day. These are exceptional measures being introduced in the interest of public health and support in a time of great crisis. They must be time limited, but as the position is ever evolving and changing on a daily, if not hourly basis, there must be an option to renew them for as often as is necessary. This is proposed to be done by government order, and any such order will be laid before the Houses of the Oireachtas. Part 2 of the bill relates to the amendments to the Social Welfare Consolidation Act. Section 3 sets out the necessary definitions. Section 4 allows, importantly, for self-employed PRSI contributions to be taken into account in the qualification criteria for illness benefit. This is only for the specified circumstances related to COVID-19. The purpose is to provide an income support to self-employed people who are unable to work based on a diagnosis of COVID-19 or who are required to self-isolate as a probable source of infection of COVID-19. Illness benefit will not be extended to the self-employed in this bill other than for this specific situation. Section 5 provides for amendments to Section 40, which deals with entitlements to illness benefit. Section 41B changes the contribution conditions so that employees and self-employed people will qualify for illness benefit based on a minimum number of contributions. The number of contributions will be specified in regulation and will be set at 1. This is, in effect, a nominal number. This is necessary in order that claims can be processed and to simplify the legislative changes now proposed. Section 47 defines categories of people who are incapable of work for the purposes of this special illness benefit payment. These will be people who are certified by a medical practitioner as being diagnosed with COVID-19 or as a probable source of infection of COVID-19. People who have been notified, including by order by the Chief Medical Officer of the HSE, that they are a probable source of infection, and people who are deemed under regulations to be a probable source of infection, and also people in respect of whom a relevant order under the Health Act 1947 is in operation. Section 48 provides that where people receive paid sick leave from their employer, people such as public servants, they will not be allowed to apply for this payment. Section 49 provides that the condition of 6 waiting days, which generally applies for illness benefit claims, will not apply in these special circumstances. Section 40(10) enables the Minister to prescribe the minimum PRSI contribution conditions required for this payment, and as already indicated, this will be set at a nominal level of 1. Section 40(11) enables the Minister to vary the rate of illness benefit by regulation, and the purpose of this is to allow for a special payment rate of €305 for such period as may be prescribed in the relevant circumstances. Section 40(12) specifies that COVID-19 and its variants is the infectious disease in question in these changes. Section 6 sets out the regulation making powers to be given to the Minister for Employment Affairs and Social Protection. These regulations are to give full effect to the measures in relation to illness benefit and set out the details that will enable the principle and policies in the bill to be implemented. The regulations will provide for setting out the people to whom the provisions apply, the manner in which a person is deemed to be a person to whom these provisions apply, the notification requirements, any variation in conditions for entitlement, including, for example, the variation in certification requirements, any additional incidental, consequential or supplemental matters necessary or expedient for the purpose of giving effect to the provisions. Section 7 provides power to the Minister for Employment Affairs and Social Protection to vary the 3-day waiting period for job seekers' benefit. Normally, job seekers must have 3 days of unemployment before they are entitled to job seekers' benefit. As many businesses are closing temporarily because of COVID-19, it's intended to remove the waiting period for people who have suddenly become unemployed as a result of COVID-19. Section 8 provides for a similar regulation making power with respect to the waiting day period for job seekers' allowance. Part 3 of the bill relates to amendments to the Health Act of 1947, targeted at the prevention and the minimisation of the spread of COVID-19. Section 9 is standard provision, providing for the definition of terms used throughout Part 3. Section 10 inserts new sections 31A and 31B into the Health Act, and the intention is to provide for regulations to prevent, limit, minimise or slow the spread of COVID-19. The regulations will deal with unprecedented circumstances, including through prohibiting some events and through imposing travel restrictions. The regulations may also be made specifying requirements to be put in place by organisers of events before an event can proceed. In addition, regulations may place requirements in relation to premises to prevent the risk of infection to people visiting or working in such premises. Requirements may also be imposed in relation to creches, schools, universities and other educational facilities, including the temporary closure of such facilities, to prevent or minimise the risk of infection. Regulations may provide for any other measure that the Minister may consider appropriate for the minimisation of the spread of COVID-19. And it's important to say at this stage, Céim Corla, many events have been cancelled, schools have been closed, creches have closed, and people have complied, and they've complied in the national interest. But it seems prudent to ensure we have legal clarity in relation to these matters. Subsection 2 sets out what the Minister must have regard to in making regulations, reflecting the extreme nature of this national emergency. Under subsection 3, in making the regulations, the Minister will consult with all other relevant ministers and other relevant persons. Subsection 4 provides that the Minister may exempt specified classes of persons providing essential services, statutory functions, other specified public services or other services from the provisions any regulations have made. This is important to maintain essential services during a time of emergency. Subsection 5 provides that this new section is without prejudice to other provisions in the Health Act 1947, including as they may relate to COVID-19. Subsection 6 provides for offences relating to regulations and compliance. Subsections 7 to 12 have enforcement powers, including powers for An Garda Síochána. There are also related offences. Subsection 13 provides for the implementation and enforcement by relevant persons, for example, medical officers of health. Subsection 14 provides for assistance to relevant persons by An Garda Síochána, and subsection 16 defines terms used in section 31A and 31B. The new section 31B provides that the Minister may, by means of an order, specify an area or region to be an affected area. This means an area where there is a high risk of infection or importation of COVID-19. Travel restrictions and event restrictions relate here. When making an affected area order, the Minister will have regard to the advice of the Chief Medical Officer and will consult with other relevant ministers. Section 11 inserts a new section, Section 38A, into the Health Act 1947. The intention of the new Section 38A is to allow a medical officer of health to order the detention and isolation of a person where the medical officer of health reasonably believes that the person is a potential source of infection and where the person refuses to self-isolate. The medical officer of health must keep the person under review, and a medical examination must be carried out as soon as practicable, but in any event no later than 14 days. This reflects the incubation period and is intended absolutely to indicate an outer time period. In practical terms, the person would be medically monitored throughout any time period. The person detained may also ask for a review of his or her temporary detention by another doctor. Subsections 1 and 2 set out what the order provision and what the medical officer must consider. Subsection 3 imposes a requirement upon a medical officer of health to certify his or her opinion in relation to the matters outlined in the order. Subsection 4 requires a medical officer of health who makes an order to keep the matter under review and ensure the medical examination is carried out. Subsection 6 provides for a review by another doctor where one is requested by the patient. The intention under subsection 7 is that the provisions of subsections 2A to G, 3, 4 and 5 of section 38 of the Health Act shall apply to a person who is subject to detention and isolation. Under subsection 9, costs of maintenance and treatment will be paid for by the HSE, and subsection 10 defines the terms used. I'm conscious as we introduce emergency legislation in our houses of the Oireachtas at a time of great national anxiety, it's important to say to people in our country that these are measures that are there for exceptional circumstances should they arise. The way we intend to continue to deal with this public health emergency is through the cooperation of our people and collaboration amongst all of our state agencies. But we must and we will legislate to ensure we have all of the powers we require to help save lives from this virus as well. Because COVID-19 is having an immense impact on our society. These are unparalleled and extraordinary circumstances, and our primary and sole objective is to safeguard the lives of our citizens and ensure that they have sufficient financial resources as we work our way through this crisis together. I hope that in these troubling times people can be reassured that we have extensive and detailed and evolving plans to deal with every aspect of this crisis. We're realigning all our systems and our services to cope with this emergency. And part of this realignment is to free up resources so people get treated as quickly as possible, and crucially so that people get payments as rapidly as possible. The Government will continue to work closely with all stakeholders across society as we respond to the crisis, and we'll continue to work with every member of these houses of the Oireachtas in this regard. I want to acknowledge again the incredible response to date of so many people in our public service, right across departments and agencies, particularly in the health sector on the front line, but also in relation to this bill, people in the Department of Employment Affairs and Social Protection who've worked so hard to get us to this point. These frontline staff have stayed in post. They've gone above and beyond what any of us could reasonably expect of them in making sure that people can be tested and treated and have access to income supports. We cannot provide the certainty that we would all crave as people in terms of the course this virus might take. But what we can do today, together, is assure the Irish people that they will not be alone as we face it. Gurmada.